What is the best action for the nurse to take when informed during a bed bath? So somebody's getting a bed bath that another client needs pain medication. So you're giving a bed bath to another client, to a client, and somebody else needs a pain medication. Let's see. Administer the pain medication to the other client after finishing the bath. No, I mean they're scheduled to get a pain medication. We gotta see what's going on. What if they just had like open heart surgery? So no, you don't just forget the patient. You got to find out. Somebody's getting a bed bath. Somebody's here with pain. We got to address priority. Pain is priority. Determine the last time the pain medication was given to the client in pain. That is a pretty good action. Let's see if we can find a better one. It's good to determine if it's due. Interrupt the bath, administer the pain medication to the other client, and return to the first client. That's actually probably the most reasonable thing. Bed bath isn't really priority. That can be done later. You got to administer the pain medication to the other client and then you can return to the client. Make sure though, safety is very important. So you want to make sure that if you're going to stop the bed bath, you cover the patient up and you are going to make sure the rails are up. But let's see the next one. Inform the client in pain that the medication will be given as soon as the bed bath is done. No, what if the bed bath takes some time? It's not going to be the best answer. Determine the last time the pain medication was given to the client in pain. That's pretty good. But the most important thing is actually to stop the bed bath and administer the pain medication because it sounds like they need the pain medication, okay? Which is determining which client would be the most suitable for assistive personnel to care for during their shift. The most appropriate assignment for the AP would assisting a client with difficulty swallowing food and fluids. This can be a little tricky because the client can aspirate, so probably something I want to give the AP something that's a little less difficult. Let's see. Conducting a colostomy irrigation for a client. That's pretty hands-on. A colostomy irrigation is a surgical procedure. Probably is not something I'd want the AP to deal with. Collecting a urine specimen from a client. That's actually pretty simple. That's not invasive at all. You're not dealing with like a colostomy, like something that just happened with like a surgical procedure or aspiration. That's pretty good. Let's go to the next one. Administering continuous tube feedings to a client. Yeah. All these things have to do with something that's invasive, like the colostomy was a surgical procedure, or something that can cause the patient to aspirate and then, get sick. I think the one that I'm most comfortable with is collecting a urine sample from a client. That's simple enough. Anybody could get that. The nurse manager is talking to the employees about the procedures to follow during a tornado at the facility. Which of the following actions would be included in this conversation? So we have a tornado that's going to affect definitely. So you have a building here. If you have a building, you have the tornado outside. You got to get people into the middle of the place. You got to get them away from the danger areas, okay, where the tornado is gonna hurt. You got to get them into the middle. Move the beds away from the window. Yep, that sounds like a good idea. Select all that apply, right? Sounds like a good idea to me. Leave the doors of the patient rooms open. No, because we're going to keep people safe in there. So we're going to block that. No. Close the windows, coverings, and curtain. Yeah, let's barricade this as best as we can. That's the building. Let's block it. Move the patients who are able to walk from the halls to the rooms. So you want to move them from the halls, which is the safety place right here, and move them to their rooms? Probably not. Cover patients who are restricted to their beds with blankets. Yeah. Do anything you can to cover the patients that are restricted. If you can't move them and they're stuck, then we got to do the best we can to protect them where they are. So those are the three options. Move them away from the windows. Check. Close the window coverings and curtains. Yep. And cover the patients. Sounds good to me. The nurse manager has made a change from a functional to team-based approach in nursing care delivery. However, an assistive personnel is not supporting the changes, not participating actively. So we got troublemaker. What is the best way to handle this situation with the AP? All right, so we got a troublemaker. What do we do? Do we disregard it? No, of course not. You gotta deal with problems head on. So we got into this field to deal with problems. Use force in the AP. Yeah, right. We don't live in those times no more. Never use force. Encourage the AP to express their emotions and thoughts about the change. I think that sounds about right. We want to talk about our feelings. So let's find out what's going on and see what's the issue. Let's see the next one. Offer incentives to the AP. Yeah, I'll pay you $500 to do your job. No, they're already getting paid. What more incentive? They should be wanting to help people. So encourage the AP to express their emotions and thoughts about the change. Which client would the nurse in the emergency department prioritize for triage during the evening shift? So we have the evening shift and we need to prioritize for triage. Who do we worry about first? Client with chest pain reports eating a very spicy pizza. This could be GERD. I mean, it's a very spicy pizza causing your chest pain. But chest pain is never a joke because you're always thinking about the heart. Let's see what else we got. A client with a small laceration, so small laceration on the index finger. Oh, give me a break. Sustained while cutting an eggplant. That is not priority. We got somebody here that we might be worrying about their heart. That's not something we're too concerned about. A client experiencing muscle aches, headaches, history of seizures. So history of seizures, not currently seizing, but has muscle aches and headaches. I have these all the time. This is not emergent. They're not actively seizing right now. They have a history of that, just a headache. Take a Tylenol. A client who twisted their ankle while rollerblading and is seeking pain medication. So we got a person that twisted their ankle. I mean, it's pretty painful. They're rollerblading, so they did this themselves accidentally. Seeking pain medication. Not emergent. They're not dying. The only one here that could possibly die is the person with chest pain. Because if we miss a cardiac source of chest pain and the patient dies, that's on us. So prioritize for triage here during the evening shift, the chest painer. Which client would the nurse plan to attend first among their assigned patients during the day shift after conducting initial rounds and checking all clients? So who's the first priority? Client who's walking around with a stable gait. Yeah, right. That patient's almost as good as you. You're probably going to get discharged. That is not priority. Client with a white blood cell count of 14,500. Yeah, his white blood cell count is greater than 11,000. That's serious. It's an infection. And a temperature of 38.4. That's greater than 38. Remember, greater than 38 is it means it's greater than 100.4. So real temperature. This is a sick person. We need to watch this person. Let's see. Let's go to the next one. Client who just took a pain medication of opioid after surgery. They just got their medication. They're okay. Everything will be fine. That is not priority. A client who's scheduled to undergo their first crutch walking therapy session. That's a physical therapy issue. And that's not us. So, client with a white blood cell count of 14,500 and temperature. These guys is almost getting like SIRS positive, getting septic. All right. So that's priority. The nurse working in a long-term care center is arranging tasks for the patients on a nursing unit. The nurse needs to assign 4 patients and has a licensed practical nurse. So you got an LPN, you got 4 patients in LPN, and 3 assistive personnel APs as part of the nursing team. Which patient would be the most suitable for the LPN? So we definitely know the LPN is more trained than the AP. So what is the most difficult task we have here? A patient needing a bath. Yeah, no. The AP can get that done. A patient who requires abdominal wound cleansing and dressing changes every 3 hours. That sounds pretty intense. Let's see the next one. An elderly patient who needs to walk freely. No. People walk their family members all day. That's something that can be done easily by an AP. A patient who needs their vital signs measured every hour. That's not invasive. You just measure their vital signs. That can be done every day. Most thing that requires most skill. Patient requires abdominal wound cleansing and dressing changes every 3 hours. You know, this is a possible cause of infection if it's not done right. So that's the one. The charge nurse is arranging the daily assignments. Which aspects would the nurse take into consideration when assigning tasks? Select all that apply. So how do we assign tasks? Do we do requests from the staff? No. This isn't a buffet. You don't get requests. You get what you're assigned. Whatever the charge nurse decides. The severity of the patient's conditions, is that something taken into account? Yeah, absolutely. Sicker patients need more help, so then you might have to worry about who gets assigned to that patient, skill level, and all that. The patient's requirements and the capabilities and needs of the staff, absolutely. If a sick patient needs more help, you get more assignment there. The arrangement of the rooms in the unit, no. If the interior design or the interior decorator of the hospital didn't make it nice for you, too bad. You just got to go where you got to go. The expected number of patient releases. So whoever's getting discharged, no, we don't assign people based on discharges. We assign them based on the severity of the patients and what the patients needs and what the capability of the staff is on hand. So it's going to be these two right here, okay? Remember, it's not a buffet. We don't care about the interior design of the hospital. We deal with what we deal with. Which client should the nurse assess first when making rounds for 4 patients? So, who should the nurse worry about first when we're dealing with 4 patients? A patient with asthma who's requesting a breathing treatment. So we have asthma requesting a breathing treatment during the previous shift. So here we have a patient that's suffering from breathing. They have asthma, and this was supposed to be something that was addressed previous shift. This is pretty important. Let's keep moving on. We'll keep this one in mind. A patient is being prepared for discharge after surgical procedure and has been prescribed new medication. This is not somebody you worry about first. They're already being prepared for discharge. It's not too important right now. We need to deal with things that are emergent. A patient who needs daily dressing changes for a recent surgical incision. Daily dressing changes, so that's every 24 hours. That's not something that's emergent. If they were like septic, if it was infected, that would be something that'll be more concerning. If their vitals were unstable. A patient who needs a chest X-ray after having a nasogastric tube inserted. So we just put in an NG tube, and we need a chest X-ray just to verify placement. That's why we got the chest X-ray. That's not emergent. Here we have a patient that's suffering, breathing, and was supposed to get a treatment previous shift. We got to worry about our ABCs, our airway, breathing, and circulation. ABCs here, okay? So that's where we're going to go. Which situation demonstrates a characteristic of the team-based model of nursing practice according to the agency orientation intended by the nursing graduate? So team. Anytime you think of a team, you think of a leader, and you have your followers. Team-based approach, RN will be the leader. So let's see what we got here. The assignment of specific tasks to each staff member for a group of clients. So you have a specific task, let's say like collecting urine samples to each staff member for a group of clients. So you're going to tell one staff member, A, you're going to collect all the urine samples for this client. This is not very effective. You have different roles and patients have different needs at times. So this is not really a team-based approach. Leadership of an RN, I like that word, of RN in guiding 2 LPNs and 3 APs and providing care to a group of 12 clients. That's more like it. You have a team where you have a leader that is guiding and you have your 2 people that are assisting you, your 2 groups of people there. So let's see the next ones. The designation of a staff member to assess the client's needs at home and initiate discharge planning. That's not the nurse's job. That sounds like more like social work. You're caring for people in the hospital. You're not worrying about what happens afterwards. The sole responsibility of an RN for caring for a group of 6 clients with the assistance of assistive personnel. So you are taking care of 6 clients with the assistance of assistive personnel? No. You have to, the sole responsibility, I don't like that word. We're a team. We are in it together. That's the word for team. So the only one that fits it, this one right here, I like that one.